And so if you're easily panicked and stuff, then you might want to skip this particular podcast episode. I was going to share with you something that I read today about Italy, the extraordinary decisions facing Indian doctors. And it's kind of scary, and hopefully this, I can say hopefully this won't happen where I live or other countries, but if we don't flatten the curve and we don't self-isolate and self-quarantine, wash our hands and basically stay at home as much as possible, and if the governments don't, in countries that don't have Medicare for all, like the United States, and where people are very, they're living in hand to mouth basically almost, or there's lots of homeless people, or the people who are, working casual work and who are working 2 to 3 jobs. And then I'm talking about the United States, and having Trump as a leader who is sort of, I don't think he cares if people die, then that's going to be a problem. And so that's why it's up to each of us to self-isolate, self-quarantine. And what's happening in Italy is quite scary, and this could happen anywhere if people don't flatten the curve. And flatten the curve means the amount of people that are contagious. If people, keep away from others, social distancing and all of that, it will prevent a major spread. And the thing that is happening in Italy is that there are not enough beds in ICU, intensive care units. There are not enough doctors and nurses to look after people. And unfortunately, they're having to start to do like a wartime-like triage system where they're people over a certain age, they just have to leave them to, they just have decided not to treat them and only treat people who look like they have a good chance of survival. But people over a certain age, they're basically leaving them to die. That is sort of like a wartime triage stuff. It's catastrophic triage. This is, happening right now in the 21st century. And this is the problem with end-stage capitalism and oligarchs and who are corrupt and greedy, like Trump. And this is what happens in where we're not working together as an international community and working for people, not for corporations. This is, I'm sorry to say that, but end-stage capitalism has helped bring about this, because if we cared about people and we had a uniform response and we, could and dealt with this, because we would all have universal health care, and we would put all our resources into this instead of sort of worrying about the economy, which is what a lot of governments do. They worry more about their buddies in business and the stock market than they do about people. This is sort of part of this, our imminent human extinction is having leaders in quotes like this. So, but, that's not going to, sort of going on about that now isn't going to particularly help, but this is where Medicare for all is essential for places like the United States, and should be something that every country should have right at this moment, Medicare for all. In fact, Spain has actually decided to make public all the private hospitals. So basically they're, putting in there's no private hospitals now at the moment. Every country should have universal health care right now to deal with this pandemic. And every government should be doing its best. And I don't mean this I don't mean to use this in malicious ways and introduce kind of martial law, because this is what governments like to do, control the people and introduce, usher in fascism via this pandemic. But I mean, they should they should take the advice of the World Health Organization and that sort of thing, and be basically trying to do what, I think it was, is it Spain has also basically stopped, or is it France? Spain or France has stopped, basically locked up shop. They won't let anybody in, I think. Canada won't let anybody into the country except for United States citizens. That's kind of crazy, because I think there's going to be a major issue in the United States, because a lot of people seem to be not taking this seriously and are out going to, like there was I saw on one member of the Disney family posting, she said, what the F about this gathering at Disneyland? Masses of people. And somebody posted something on Twitter which was just ridiculous, as if it's great to be rebellious against this whole idea of social distancing. And they showed some photo of somebody in Nashville, of everybody in this small venue. like heaps of people in a small venue. This is no joke. This is not a time to sort of go, oh, I'm not going to do what anybody tells me. This is actually requires a global effort to address something that is a catastrophe. And you only have to see what's going on in Italy to get an idea of what can happen in the rest of the world. As I posted just recently, a doctor in ICU in Toowoomba, in a small country town in Australia, they have 75,000 people who live there. And if a small percentage, which is what would be predicted in this pandemic, if a small percentage of those had to require ICU, intensive care treatment, that would mean there would be 3,750 people would require ICU treatment, and at the present time they only have 12 beds, and they can only increase that to 25. So do the maths with that. So that, if it became to that, it then becomes like Italy. You see what I'm saying? So this is like a real issue. And I'm not trying to panic people, but I'm just trying to urge people, to do self-isolating. Anything that is not essential, don't do it. And try and, sort of practice every sort of safety you can, washing hands, not touching your face, which is so hard sometimes. Jimmy Dore actually posted something very funny where he said, when I remember to stop touching my face is in the middle of touching my face. That can be the case. So anyway, I have to go into a hospital. I have to go into town, into the major city here in Tasmania to attend a hospital appointment, and I intend to. If I have to get into a lift, I'm going to wear a mask and sit as far away from people as I can. It's about my arm, that I broke my arm, and I'm just having it checked before I can take this splint off. And I have to. I don't really want to go, but I have to, because I have to see an orthopedic, sort of doctor, just to make sure, and have an x-ray and make sure everything's okay, before they let me take the splint off. So, I'm going to do that, wear a mask in the hospital and not touch anything if at all possible. And I'm going to even wear, a gloves that you wear in winter sort of thing. Well, it's getting cold here anyway, but I'm just going to wear one glove. This one doesn't touch anything, the arm that's affected. And I'm going to do my best not to touch things. And then when I come home, I'm going to wash my clothes and that I wear, and wash the glove that I used, and that sort of thing. Throw away the mask before I come home, and all of that. So, it's, these things we have to sort of think and flatten the curve. Otherwise, there will be not enough beds in intensive care or in the hospital, just like in Italy now. There will be not enough health professionals to be able to address the amount of people that are going to come in if we don't flatten the curve and flatten out the contagious effects of this pandemic, COVID-19. So anyway, so I'm going to just share some parts of this about this article from The Atlantic, and I'm not recommending The Atlantic at all, but this is a good article, and I'm sure the Jimmy Dore Show will probably have some different little snippets from their live stream today where they were talking about this. And by the way, this is kind of fascinating at how, like, for example, Gavin Newsom, who I think is the mayor of California, he was saying how they're going to now address the homeless people situation. Is there 100,000 in California? I'm not sure. 100,000 homeless people. So he hasn't been addressing the homeless situation until now, because this affects people in power. This affects politicians. And so that's why he's decided to do something. Of course, he's not going to say that, but now he's addressing the homeless situation. I can't remember from that live stream. I didn't catch all the things he was doing, but you can probably see on their website, San Francisco local government website or whatever, what they're going to do about that. But see, isn't that appalling? See, this is what capitalism does. They don't care. This is an indictment of capitalism, that we have homeless people, firstly, and then how the oligarchy view homeless people, that they're irrelevant, and the mainstream media, who are corporate-owned, treat the homeless people with contempt. And so you see it very clearly in times like this, where the oligarchy, some politicians feel threatened, and then they start doing what they could have done all along. They could have done this all along, help those homeless people, and they didn't. So that's Gavin Newsom from California, and so this gives you an idea of sort of how this shows very clearly how messed up capitalism is, for example, in America without Medicare for all. And I'm going to show you something too in a separate video, how Trump is trying to get exclusive rights to the coronavirus vaccine, and he's putting pressure on a business in Germany who is working on this vaccine. I don't know how long it'll take for them to get the vaccine, completed and for it to be available to the public. But Donald Trump, this is what capitalism is. Donald Trump is trying to buy exclusive access to that vaccine, so that buy it up basically, so that no one else can use it, and no one else outside the United States, and he can decide what countries get to use it. And you can guarantee that it won't be Iran, because they've already got crippling sanctions on Iran, and things are so desperate there now, so desperate that doctors have to reuse masks. They can't. The economic sanctions have already crippled Iran, and they're in active war. And then now they're withholding medications from them as well. And when Trump finally gets this vaccine, I bet you that he withholds from Iran. So they're struggling terribly in Iran. There's, I think, 10,000 cases of coronavirus, COVID-19, and I think there's about 200 people have died or something, or is it more? But this is the thing. They could do that. They could withhold it from Iran. They could withhold it from China.
The blind, the one-eyed man is king. Similarly, in the land of the infected, the man with the vaccine becomes a god.
The Tübingen-based company CubaVac is researching a corona vaccine under high pressure. The US government wants to secure the rights to it exclusively. The German government is trying to prevent this.
There are only two reasons why anyone would want a monopoly on a vaccine. The first is money. It would take a truly miserable creature to try and profit from a cure that could save millions of lives. But hey, capitalism. Two, control over who gets vaccinated. And if Trump does get exclusive rights to a vaccine, guess who'll be last on the list for an injection?
Harsh economic sanctions imposed by the Trump administration have contributed to a shortage of test kits and medical supplies in Iran.
Masks and disinfectants are not easy to get at pharmacies. They are all out of stock. The situation is really bad. My family and I could be infected at any time.
In effect, American sanctions against Iran's ballistic missile program also include face masks and coronavirus test kits. Heck, even an Iranian app to help people identify the symptoms of a coronavirus infection was banned by Google because sanctions. Well, take Venezuela, a miserable playground for American foreign policy.
This is a time to demand that President Donald Trump lift criminal sanctions against Venezuela so that Venezuela can go into the market to buy everything it needs on a medical level to face this situation.
If anyone ever tells you that the purpose of sanctions is to change a government's behavior, you go ahead and laugh in their face, long and loud. Mass sanctions have one purpose: to make life miserable for the entire population, to make the public hurt and suffer, to make them do anything to make the pain stop, including overthrow their government.
Patients in hospitals don't even have water. Now imagine with an epidemic like this that reaches us, the country is going to be left alone. We have to be clear. The plague has arrived here, and the rulers don't have any problems because they have their bunkers, they have their clinics, they have everything.
Cubans, most of whom have never known life without US sanctions, are being urged to make their own face masks.
So, how to get masks when there is a lack of medical supplies? Very easy. We can make them at home from materials such as cotton, cloth, linen. They're washable, and we can carry several, depending on the hours that we will be in public places.
The end result has been the near collapse of healthcare systems in numerous countries. Tens of millions of people limited in healthcare, in medicine, in essentials, basically tied hands and feet on the sacrificial altar of the coronavirus pandemic. And if, God forbid, Trump does get exclusive rights to the vaccine, you can bet your life savings it'll come with strings attached.
China's actually contained this situation, it seems, and that's because they have a command economy and they can build hospitals in 10 days, and they can it can be a little bit draconian, but it's actually working, and it's containing the, because they have 1.4 billion people in that country. So it would be a disaster in some ways if they didn't enact extreme measures to contain it. Cuba is sending medical people to help, I think. I'm not exactly sure where, but this is typical of Cuba, how they help other countries. This is socialism, for all it's vilified in the media because they're all capitalists and they're greedy and they don't care about people, right? And the same with politicians. They're capitalists, as Liz Warren said. She said, "I'm capitalist to the bone." When you sort of have a extreme sort of a greedy ideology like that, you're going to not be caring about you're going to pretend that you care, which is what a lot of them do. But Cuba has been sending, as usual, sending medical people around. China has been sending medical people to Italy to try and contain the virus. And for all these, not that I'm saying China's necessarily socialist, it's got a lot of capitalist themes in it, of course, but it's you don't see that happening in extreme capitalist countries like, end-stage capitalist countries like the USA. All they're interested in is boosting the economy by injecting $1.5 trillion, I think, the U.S., Donald Trump injected to boost the stock markets. It's just, as somebody said, socialism for the wealthy, and stuff the rest of us. So, when they need to, they use the sovereign economy for corporations and for Wall Street. But they don't use the sovereign economy for the people unless absolutely pressed. If they introduce a UBI, which I think a UBI is not a good thing in a general sense because it's a neoliberal scam. But in this case, with the pandemic, as long as it's for emergency measures, $1,000 a month for people in California. I think Gavin Newsom or somebody has introduced that to California. I don't know, but I haven't been following too much of this because it's a universal basic income is helpful in a situation like this because a lot of casual workers, and there's lots in the United States, they cannot afford to stop work for 2 or 3 weeks and not be paid. So this is where if you didn't have an end-stage capitalist economy or country, they would be supporting everybody because the sovereign economy can do that. And that's where you need to learn MMT. LEARN, MMT is a hashtag. Check that out and check out Bernie Sanders' economic advisor, Dr. Stephanie Kelton, who is a proponent of MMT. And MMT is simply a description of the operational reality of a sovereign economy. So anyway, and in Australia, they think that the economic downturn triggered by this pandemic could be as bad as the Great Depression in 1930. That's one of Australia's most influential economists said that. So, but this isn't about the economy, really. This is about people's lives, and that's where governments fail because they're more interested now in their corporate buddies and keeping corporations afloat and keeping businesses afloat than they are about addressing seriously this pandemic because of people. I'm going to share with you a little bit of this article. I pretty much sort of given you a synopsis of what they're doing now in Italy, and it's sort of tragic, but I'm going to share a little bit of this with you. 2 weeks ago, Italy had 322 confirmed cases of coronavirus. At that point, doctors in the country's hospitals could lavish significant attention on stricken patients, on each stricken patient. 1 week ago, Italy had 2,500 cases of the virus, which causes the disease known as COVID-19. At that point, doctors in the country's hospitals could still perform the most life-saving functions by artificially ventilating patients who experience acute breathing difficulties. Today, Italy has 10,149 cases of the coronavirus. There are now simply too many patients for each one of them to receive adequate care. Doctors and nurses are unable to tend to everybody. They lack machines to ventilate all those gasping for air. Now, the Italian College of Anesthesia, Analgesia, Resuscitation and Intensive Care has published guidelines for the criteria that doctors and nurses should follow as these already extraordinary circumstances worsen. The document begins by likening the moral choices Italian doctors may face to the forms of wartime triage that are required in the field of, quote, catastrophic medicine, end quote. Instead of providing intensive care to all patients who need it, the authors suggest it may become necessary to, quote, follow the most widely shared criteria regarding distributive justice and the appropriate allocation of limited health resources, end quote. The principle they settle upon is utilitarian, informed by the principle of maximizing benefit for the largest number, end quote. They suggest that, quote, the allocation criteria need to guarantee that those patients with the highest chance of therapeutic success will retain access to intensive care, end quote. See, this is the 21st century, and this is like frightening. But this is what could happen to other countries, just like Italy. This is what could happen if we do not flatten the curve. And that's why self-isolation, self-quarantine, social distancing, washing your hands frequently, not touching your face, eating properly. I suggest eat a plant-based diet and check out the nutritionfacts.org, how not to die in a pandemic, which is coming up soon as a webinar, but he'll be providing that live stream, I think, on the site, and people ask questions. So I've done a video just recently about that particular webinar. Anyway, so this is what could happen. That's why flattening the curve is essential for survival, basically. Those who are too old to have a high likelihood of recovery or who have too low a number of, quote, life years, end quote, left, even if they should survive, would be left to die. This sounds cruel, but the alternative, the document argues, is no better. Quote, in the case of total saturation of resources, maintaining the criterion of, quote, first come, first served, end quote, would amount to a decision to exclude late arriving patients from access to intensive care, end quote. In addition to age, doctors and nurses are also advised to take a patient's overall state of health into account. Quote, this presence of comorbidities needs to be carefully evaluated, end quote. This is in part, this is like a survival of the fittest, basically. They're going to select who is fitter and that has more time left to live, and they're the ones that are going to get the treatment. Quote, the presence of comorbidities needs to be carefully evaluated, end quote. This is in part because early studies of the virus seem to suggest that patients with serious pre-existing health conditions are significantly more likely to die. But it is also because patients in a worse state of overall health could require a greater share of scarce resources to survive. Quote, what might be a relatively short treatment course in healthier people could be longer and more resource-consuming in the case of older or more fragile patients, end quote. These guidelines apply even to patients who require intensive care for reasons other than the coronavirus, because they too make demands on the same scarce medical resources. Oh, I see. So they're actually saying that even like if a patient comes in and they're not suffering from coronavirus but something else, and it looks like they're not going to survive, or they're very old and they wouldn't make it with intensive care, or even if they would make it, they're going to be excluded as well. This is like, yes, as they say, catastrophic medicine, which is sort of, quote, this criteria apply to all patients in intensive care, not just those infected with COVID-19, end quote. My academic training is in political and moral philosophy. I have spent countless hours in fancy seminar rooms discussing abstract moral dilemmas like the so-called trolley problem. If a train is barreling toward 5 innocent people who are tied to the tracks and I could divert it by pulling the lever, but at the cost of killing an innocent bystander, should I do it? Part of the point of all those discussions was supposedly to help professionals make difficult moral choices in real-world circumstances. If you are an overworked nurse battling a novel disease under the most desperate circumstances and you simply cannot treat everyone, however hard you try, whose life should you save? Despite those years of theory, I must admit that I have no moral judgment to make about the extraordinary document published by those brave Italian doctors. I have not the first clue whether they are recommending the right or the wrong things. But if Italy is in an impossible position, the obligation facing the United States is very clear: to arrest the crisis before the impossible becomes necessary. The means that our political leaders, the heads of business and private associations, and every one of us need to work together to accomplish two things: radically expand the capacity of the country's intensive care units and start engaging in extreme forms of social distancing. Cancel everything now. So that's the letter by Yasha Mounk. He's a contributing editor to the Atlantic, an associate professor at Johns Hopkins University, a senior fellow at the German Marshall Fund, and a senior advisor at Protect Democracy. Now, Protect Democracy is, I think, a neoconservative right-wing think tank. So I would gather that. So, I'm not recommending that author. And I'm also not recommending The Atlantic, because The Atlantic posts a lot of national security state talking points, which lead to war and stuff. So anyway, but that's a good article, and I hope that you I hope we all work together to defeat this virus. And I hope that people go vegan and stop using animals, because even though there are talks about this being a bioterrorism attack by possibly the United States, that one ex-CIA official who's a counterterrorism official, his last name is Giraldi, did an article on that and thought that it was probably something done by the United States or something, like an attack on China, China is in the crosshairs of the United States because it's an economic threat to the United States, and they can't abide by that, capitalism. So that there's those stories, but I'm not going to get into those sort of theories about this sort of thing, because at this point in time, there's no point in that really, and it is speculation too. At this point, maybe later on they may actually be able to sort of do some detective work and see the origins of this and whether it has artificial, whether there's other, whether it's been developed in a lab. But at this present time, it's a pandemic, and if it's a bioterrorism attack by the United States on China and Iran, the two countries badly affected. I'm not sure where Italy comes into that. But anyway, so if it is, that's not relevant right now. What is relevant right now is that it is addressed by all of us to defeat it. And so that then maybe this might be a trigger to these, idiots in politics, that how fragile our system is, how fragile capitalism is, how destructive and cruel and greedy it is. Of course, these people, I don't think it's going to dawn on them, because they have to already have almost like psychopathic tendencies not to care about homeless people and people that are suffering and poor and dying because they can't get health care. So I don't think it's going to click to them. But maybe the United States, for example, will realize how they absolutely need Medicare for all, and they will work towards that and have a grassroots movement that works towards that and stops relying on these politicians to give them what they need. There has to be something else, because the system is so corrupt in the United States, the electoral system, voter suppression and all of that, the paper ballots that would actually, the electronic voting machines, all of those things, they're not going to bring about a revolution through voting. And if that was possible, it wouldn't be legal to vote. They don't want people to have, they don't want a people's movement anywhere in the world. That's why the CIA goes around crushing people's movements. And that's why it's trying to, the US is trying to sort of crush the Bernie Sanders people's movement, because they don't want a people's movement. They want their buddies, their corporate buddies in Wall Street and themselves in power, and they don't want to relinquish power to anybody in the public. They want to have they want to be greedy, and they want to take as much as they can. But they're not exempt from this pandemic. They're not exempt from it, and so now they're freaking out a bit, and now they're starting to implement measures they should have done anyway, and they may even bring in temporarily Medicare for all in the United States to address it. I don't see that happening, and at this stage, they've left it so late, and there's a lot of people who aren't complying with the ideas of social distancing. I think it's going to be a disaster. I hate to say that, but I do. And it could happen here in Australia, if we don't take it seriously. We could end up just like Italy. Excuse me. We could end up just like Italy. And I'm in an age group now, I'm almost 60 this year. They might think I'm irrelevant and if it gets to this level of Italy, and think, well, she's lived 60 years, that's enough for her. We won't treat her. And that's okay. That's okay. I have lived 60 years, and so, and I've had a good life. And so if that's the case, if somebody else gets to live because there's not enough resources and they're younger than me, then, that's c'est la vie, that's life, But I hope that it doesn't go like that in Australia. I hope it doesn't go like that anywhere. We're all in this together, and when I say to go vegan, because this is a zoonotic disease, even if they say it's developed in, it's a zoonotic disease. If it's developed in a lab, that's one thing. But if it's actually come from wet markets in China or somewhere else, then it's because we're using animals. And so, MERS is a zoonotic disease. So is SARS, H1N1. All of those different ones are zoonotic diseases and cause, and spread to people. It's an animal to human transmission. So we need to stop using animals because first, they're not our resources, they're not our property, they're sentient. Secondly, for our health, because we're destroying our health in the amounts that we eat animal products. Third, because of animal agriculture is a major contributor to the climate crisis and the sixth mass extinction. And these zoonotic diseases which are contributing to a pandemic. These are all, there's a list as long as my arm of reasons to be vegan. So please go vegan. Anyway, that's all I'm going to say. Thanks so much for watching. Stay tuned. My next video is going to be about Trump and his trying to get by the exclusive rights to the coronavirus vaccine, the COVID-19 vaccine, and how that'll be disastrous for Iran. And because they're in the crosshairs of the U.S. empire, and they're suffering already with economic sanctions and with the drugs that are being withheld from them from outside, and now it could be that too. I mean, it's absolutely immoral and absolutely disgraceful. So anyway, thanks for watching. My name is Trish Roberts. You're watching Faint Signals from Vigo. Please subscribe if you haven't already. Click the notifications bell. Otherwise, you won't receive notifications when I drop a video. Please leave comments and hit the like button if you like this content. Okay, thanks for watching. Till next time. Bye for now.